So how have IBD nurses accommodated the delivery of care to patients during the pandemic? And in fact, actually, a lot of the comments when we were asking about kind of the general how things have changed over the past two months, I think that the biggest change is being the accommodation. And Jen, I'd be curious to hear your experiences with how things have changed in Hamilton, in your clinic. How have you accommodated the patients when they've come to you with concerns about care and delivery of care?
Yeah, early on, we did have a significant decline in accessibility to our outpatient clinics. So we transitioned very quickly to virtual visits, either using our OTN, which is our provincial webcast program, or also just using telephone, which has been working really well with our patients. And I just wanted to comment on how patient and supportive people have been during this crisis. I know it's a difficult time with lots of concern and worry, but the patients have been very, very helpful and supportive. We also are using email correspondence with patients, although it is nicer to be able to communicate directly with them. I agree with Joan. We do have urgent access through our clinic as well as our emergency room if needed. So if you do require assistance, please contact us and we'll bring you in safely to be seen. Also, we've been really relying heavily on our patient support programs. They have been providing really great reassurance and education and support to our patients. So I've encouraged some of them to reach out to those people as well as those in the infusion centers who have been very supportive.
And to follow up on the infusion centers, so if somebody is asking you about their concern about going to an infusion center and getting infusion, they want to like just hold and wait, what are you telling them when they're asking you a question like that?
So that's a two-part question, but for the most part, I actually reached out to our local infusion clinic yesterday just to get some advice from them, and they have made a lot of changes to help improve the safety of our patients coming into their clinic. They have enlarged some of the clinic space. They have reduced the number of patients that are coming in at any time. They are trying to ensure social distancing of at least 6 feet between patients. They are disinfecting and cleaning the clinic very thoroughly after every infusion. And in my personal experience with a patient of mine who was elderly and who was not doing well, they were able to actually accommodate bringing her into a private room, so she was absolutely isolated from everybody else. So they've been very, very helpful and supportive.
Yeah. And just a general question to anyone, what have your experiences been with infusion centers and your patients kind of concerned about going to them?
So it's Usha. I had a patient who was very concerned about going out for infusion. In fact, she wanted to not go and wanted to say, can I miss this infusion? And we talked her out of it. And again, like Jennifer had said, the infusion center brought her in and brought her into a private room because she was very, very concerned that, and this was at the beginning, that she would contract in COVID-19 through the infusion clinic. And just to allay the anxiety for the patient, they made sure that she was in a room by herself, and also did rapid infusion. So instead of being there for 2 hours, she was done within an hour, and that sort of helped as well.
Yeah, and it's one of the reasons I wanted to give those examples in my presentation, particularly the South Korean call center, where you get a sense of how close people have to be and how unprotected they were in that environment. And in infusion centers, Jen, you described it perfectly about how they've really have said, they've removed chairs to ensure that they have that 2-meter physical distancing. They wear PPE to protect the staff and the patients. There's so many things that they're doing. They're screening individuals, everything that you said, that really minimizes that risk of transmission in that environment. And Joan, I think it looked like you were going to say, yeah, something as well, just to add, because I know you've had some very unique experiences as well.
Yeah, so I think at least in Alberta, and we're structured a little bit different than some of the other provinces in the fact that we have a provincial healthcare system. we actually came out of an interesting situation with BioSwitch, where as clinicians, having never really had a lot of interaction with Alberta Health, we started to meet with them weekly back in December. Initially started as maybe a little bit of an adversarial relationship, to be honest with you, but it evolved into a working dynamic. And as we entered into COVID and recognized, like patients, we were concerned about the security and the safety around infusion clinics. We quite rapidly rolled out provincial standards for the infusion networks, around use of PPE, personal distancing, how patients were screened, how staff was screened. We had the infusion clinics identified as essential services, so that if there was an actual quarantine put into place, those infusion clinics would remain open. Staff would be able to come to work, patients would be able to access them. And in the BioSwitch process, we had a lot of concerns around capacity of the infusion networks as we were moving patients from one infusion program, which is directly linked with the drug they're getting, to another. And we were able to facilitate collaboration between the different pharmaceutical companies in saying that they would actually support patients that were receiving drugs other than what they normally infuse, to make sure patients were staying on infusion. We've had, I believe right now in Calgary, I think we've had 3 patients that have been COVID positive. One of them was a patient that was on one of the infliximab products. And when we were looking at getting that patient back onto their normal schedule of treatment, one is they had to be clinically well. This was at a point in time where we didn't have early access to repeating swabs, but we had a clinically well patient, but we were not sure of risk. And just as Gil, very eloquently pointed out at the beginning of this, we understood the need for social distancing. And that patient actually was brought in and was infused at the end of day after hours, in the setting of being COVID negative, like without symptoms, for 10 days. That individual patient wore a mask, and then the staff wore appropriate PPE. And we've had no lateral communication within any of the infusion clinics, to my knowledge, across the country. And I think it really speaks to the dedication of those infusion programs.